Do you think the mask protects you?
I do. I think if you wear a mask and the other person wears a mask, I do think it protects you. Do I
Okay.
think it completely eliminates the risk? No, I don't think so, but I do think it reduces it significantly.
Now, the isolation that you talk about is because we can't socialize. Can't go to the movies, can't go to the concerts, can't go to the games. Some people, as you point out, do go to the parties and they, putting themselves in harm's way. But while you're not socializing nearly as much as you used to, some people are getting gassed every night. They're getting inebriated, intoxicated, and I understand this is a growing problem. Is that correct?
Absolutely. I'm seeing this across the board in a lot of my healthcare workers who I treat. Maybe they were using a glass of wine at night to fall asleep, and now they're, using a bottle to go to sleep. So a lot of them feel like when they go to work, they're on a suicide mission. They're putting themselves and their family's lives at risk. And very often, unfortunately, they use these substances to cope with that stress and that anxiety.
And they're bored. A lot of young people are bored and they just do this because it's fun, right?
Absolutely. I mean, no one wants it this way. Everyone wants to get back to their life. We want our kids to be back in school, but we can do it safely and we can do it intelligently.
I wonder if the dope dealers wear masks. Do you know that? They said the heroin people, do they have masks on? Because, that would make it harder to catch them, I guess. But,
Yeah,
I'm
but
making,
they
I'm
try to
making
hide their
light of it.
identity and they use it as an excuse, right?
I'm making light of it, but my police friends say the illegal drug trade has never been more profitable or lucrative as it is right now because people are going out and buying cocaine and heroin and meth and all that stuff because they don't have anything else to do and they want to get blasted. I guess that's what's happening.
Right, and there's also been a spike in overdoses because there's a lack of a support system. And when people overdose now, they're alone. So there's no one there to pull them out of it and give them Narcan and reverse the overdose. So that's also on the rise as well.
Do you think that psychologically this pandemic, considering that children are experiencing as well as adults, is going to have lasting emotional effects on people?
You want to know something? After the 9/11 attacks in New York City, all these mental health workers were deployed to the site of 9/11. And what they found is that the utilization of mental health services was not nearly as high as they predicted that it would be. The point is that people are a lot more resilient than we give them credit for. Certainly, there are
Wow.
going to be people that have pre-existing mental illness that are going to be exacerbated by this crisis, but I think most people overall are going to do okay in the long term.
I think the thing, there'll be more suspicion about going into strange places, flying on an airplane, that kind of thing. That'll last, but this time next year, I think we'll be back to normal. At least the normal people will be back to normal. Hey, doctor, thanks very much. We really appreciate it. Always good to see you. Hey, Bill O'Reilly here. As you all know, the dollar is at a 10-year low, and November could spell real trouble. That's why I recommend you consider physical gold and silver, and the only company I do business with in this area is American Hartford Gold. You can call them right now. Make sure you tell them Bill O'Reilly sent you, and they'll give you a free gold coin on your first qualified order. Since I have been recommending American Hartford Gold, gold's up over 40%, silver over 60%. So please don't wait. Call them now. 877 444 GOLD Gold. 877 444 GOLD Gold, or text GOLD to 65532.